Welcome back to Homeo Vision and a very good day to all of you watching this video. I am Dr. Gauthami Deshmukh and let us continue with our Organon of Medicine series. In this video, we will be dealing about aphorism number 7 and the two footnotes that come under this aphorism. In this aphorism, we will be dealing with two very important concepts. The first one being causa occasionalis. We will be talking about what causa occasionalis is, and we will also be talking about the totality of symptoms. Aphorism number 7 deals with these two very important concepts. Let us start reading the aphorism. Now, as in a disease from which no manifest exciting or maintaining cause has to be removed, we can perceive nothing but morbid symptoms. It must be the symptoms along which the disease demands and points to the remedy suited to relieve it. And moreover, the totality of these symptoms, of this outwardly reflected picture of the internal essence of the disease, that is, of the affection of the vital force, must be the principle or the sole means whereby the disease make known what remedy it requires. The only thing that can determine the choice of the most appropriate remedy, and thus, in a word, the totality of the symptoms, must be the principle. Indeed, the only thing the physician has to take note of in every case of disease and to remove by means of his art in order that it shall be cured and transformed into health. This is the aphorism number 7. Now, in the very first line of the seventh aphorism, Hahnemann has mentioned about causa occasionalis. So he says, now as in a disease from which no manifest exciting or maintaining cause, that is, causa occasionalis has to be removed. This has to be a comma. We can perceive nothing but morbid symptoms. So what he is trying to tell us here is that in a sick individual, the physician must always remove the causa occasionalis first. Now, what is this causa occasionalis? This causa occasionalis can be two things. According to the given aphorism, it can be two things. It can either be an exciting cause, correct, which we have already discussed about, or it can be a maintaining cause. So if it is an exciting cause, this will be producing an acute disease. And if in this particular sick individual, if we find a maintaining cause, then here the disease will be a pseudo-chronic disease. Please refer to the video on aphorism number 5 to understand more about these causes. So the physician must always, whenever he comes across a sick individual, he will have to first remove the causa occasionalis. Now, a brief explanation about this causa occasionalis has been given in the first footnote to aphorism number 7, which we shall go through now. So in this he says, it is not necessary to say that every intelligent physician would first remove this where it exists. So here, remove this. This refers to causa occasionalis. So if there is an exciting cause or if there is a maintaining cause in a particular patient, the first thing that the physician must do is to remove this cause. After removing the cause, whatever symptoms are left out, these are the symptoms that the physician will have to treat. So this is what he's saying. So the indisposition thereupon generally ceases spontaneously. So the moment you remove this exciting cause or the maintaining cause, the indisposition. What is an indisposition? It is a slight deviation in the state of health because of some deviation or some changes in the circumstances of an individual. So the indisposition will cease to exist the moment we remove this exciting or maintaining cause. So some examples are given. This will help you understand causa occasionalis better. He will remove from the room strong smelling flowers which have a tendency to cause syncope and hysterical sufferings. So one example is that if strong smelling flowers are causing an individual to faint, or if it is causing hysterical sufferings in this individual, what should this physician do? He must first advise this individual to remove these strong smelling flowers. So strong smelling flowers here is the causa occasionalis, and this causa occasionalis is the cause for the syncope and the hysterical sufferings that this patient is experiencing. So we will first have to remove the causa occasionalis, that is the strong smelling flowers. Second example. So this is the first example. Second example, extract from the cornea the foreign body that excites inflammation of the eye. So if there is a foreign body that is causing inflammation of the eye, any wise physician will first remove the foreign body before going ahead and treating. Loosen the over-tight bandage over a wounded limb that threatens to cause mortification, and apply a more suitable one. Lay bare and put a ligature on the wounded artery that produces fainting. So he says if there's a very tight bandage, okay, that is threatening to cause mortification, what it is very simple. We will have to loosen this tight bandage and put a more suitable one. If we have a wounded artery, okay, that is causing excessive hemorrhage, we will have to put a ligature and stop the bleeding. Endeavor to promote The next example is endeavor to promote the expulsion of vomiting by belladonna bellies and so on that may have been swallowed. Next example, extract foreign substances that may have gotten into the orifices of the body. So if there are any foreign uh, bodies that may have gotten into any orifices of the body, for example, the nose, the gullet, ears, urethra, rectum, or vagina, any wise physician, without having to mention, he will have to take off these causa occasionalis or these exciting causes which are producing a disturbance in the health of the individual. Crush the vesical calculus, open the imperforate anus of the newborn infant, and so on. So these are the examples that he's giving. So he says if there's a vesical calculus, crush it. If there is an imperforate anus and the baby is not able to poop, what has to be done? In such cases, obviously beyond the scope of homeopathy, surgical assistance will be needed. And these are acting as causa occasionalis or obstacles to cure as well. So these are the examples that he's giving. Going ahead with the explanation of the aphorism. So as I mentioned earlier, whenever a sick individual presents himself to the physician, he will first have to remove the cause. If it is an indisposition, he will have to first remove the cause. And after removing the cause, we will be left with the morbid symptoms. Okay, the true morbid symptoms. And these morbid symptoms are nothing but the totality of the symptoms of this particular case. So a very clear definition of totality of symptoms has been given. As we can see here, it is the outwardly reflected picture of the internal of the essence of the sorry, it is the outwardly reflected picture of the internal of the essence disease, that is of the affection of the vital force. So it is the true picture, or it is the true picture of the internal essence of the disease. So totality of symptoms is nothing but the picture that is reflected, or the symptoms that are given out by the diseased vital force. So whenever our vital force is affected, whenever our vital force is diseased, it puts out a picture to the physician. It presents itself in the form of these morbid symptoms so that the physician can perceive these symptoms, analyze them, make a totality out of them, and remove these totality of the symptoms in order to bring about a cure. Second, Hahnemann also says that the totality of the symptoms are the ones that will point out the remedy that the patient needs. Okay, so this is a guide for the physician to select the remedy. And further going ahead, he says that this is the only principle and sole means by which the disease shows what remedy it needs. So the diseased or the affected vital force. So here the disease is nothing but the affected vital force. So the affected vital force is showing itself to the physician in the form of this morbid symptoms, or in the form of this totality of the symptoms. Now, what must the physician do? The physician must carefully observe and make a note of this totality of the symptoms of this particular case. So, this totality of symptoms of a case is nothing but the true picture of the disease. That is, the picture that is being presented by the diseased vital force. Okay, so once you make a note of the totality of the symptoms, second, what will you do? The removal of the totality of the symptoms is going to be called as cure or restoration to health. Okay, let us now continue with the second footnote of aphorism number 7. Let me read this out first. In all times, the old school physicians, not knowing how else to give relief, have sought to combat and, if possible, to suppress by medicines here and there a single symptom from among a number of symptoms in diseases. A one-sided procedure, which under the name of symptomatic treatment has justly excited universal contempt because by it not only was nothing gained but much harm was inflicted. A single one of these symptoms present is no more the disease itself than a single foot is the man himself. This procedure was so much the more reprehensible that such a single symptom was only treated by an antagonistic remedy. Therefore, only in an enantiopathic and palliative manner, whereby after a slight alleviation, it was subsequently only rendered all the worse. So, in this footnote, what Hahnemann is trying to tell us is that in the olden times, the old school physicians did not have a concept of totality of the symptoms. They did not know what totality of symptoms was, and they did not consider anything close to the concept of totality of the symptoms. What they did was they selected one or two symptoms here and there in the entire disease. So we all know that one particular disease is going to be giving out a number of symptoms. So out of these humongous number of symptoms, the old school physicians would select only one or two symptoms and they would try to combat this one or two symptoms. Say they select just pain in the knees and fever out of a number of symptoms in this particular sick individual, and they will try to combat only these two symptoms. Okay, or they will try to suppress these one or two symptoms by giving medicines. And this type of treatment was basically a one-sided procedure. So Hahnemann calls this as a one-sided procedure. And since only single symptoms were selected from among a number of symptoms in this particular disease, this type of treatment was also called as symptomatic treatment. And here he also says that this type of symptomatic treatment gave no benefit to the patient. Okay, not only was nothing gained, so he says nothing was gained. This type of symptomatic treatment gave no benefit to the patient, rather, it did more harm to the patient. Okay, he gives one very nice example. He compares one single symptom of the disease to one single foot of a man. Say, for example, in homeopathy, we consider the disease as a whole and we consider the man as a whole. So, considering one single symptom of a set of symptoms in a disease is equivalent to considering only a single foot in the whole of a man. So, this is one very nice example that he gives. Continuing ahead, he says that this procedure was very reprehensible. Reprehensible is nothing but morally wrong. Okay. The dictionary meaning of reprehensible is something that is morally wrong. So he says, considering only one or two symptoms out of an array of symptoms in a disease and ignoring all the other symptoms and treating just one or two symptoms is morally wrong. Okay, so this procedure or the symptomatic treatment was morally wrong, and such a single symptom, this was only treated by an antagonistic remedy, that is, on the basis of contraria contraris curenta. Correct? So this was nothing but the antipathic or the enantiopathic treatment was being given. So, of course, if you use the law of contrast, what happens? It will obviously lead to a palliative treatment. So he says in this palliative treatment, by using an antagonistic remedy, what happens? Initially, there will be a slight amelioration, that is, a slight alleviation will be there, that is, a slight betterment of symptoms will be seen. But in the long run, what will happen? All these symptoms will increase in intensity. This antagonistic remedy will initially cause a slight alleviation or slight amelioration, but then later on in the long run, these symptoms will become much worse. So this is what the old school physicians were doing. And in this footnote, we talk about very importantly what is symptomatic treatment, and we come across antagonistic remedies and enantiopathic and palliative manner of treatment. So this is all about the seventh aphorism and its two footnotes. If there are any questions, please feel free to ask them in the comment section below. And thank you for watching.